Hi, everyone. Welcome to the 2023 SPOR Evidence Alliance semi-annual town hall meeting. Today, we'll have Dr. Andrea Tricco, who will be presenting. Dr. Tricco is the nominated principal investigator for the SPOR Evidence Alliance. She is also the director and scientist of the Knowledge Synthesis Team, the Knowledge Translation Program at the Li Ka-shing Knowledge Institute at St. Michael's Hospital, Uni Health, Toronto. She is also the Associate Professor at the Dalai Lama School of Public Health and Institute of Health Policy Management and Evaluation at the University of Toronto. She is the Co-Director and Adjunct Associate Professor at the Queen's Collaboration for Healthcare Equality at the Joanna Briggs Institute Center of Excellence at Queen's University, as well the Co-Editor-in-Chief of the Journal of Clinical Epidemiology and member of the editorial board for BMC Medicine, Systematic Reviews, and JBI Evidence Synthesis. And before we begin, we just have a few housekeeping notes. If you have any questions during the town hall, please feel free to put it into the chat. We will have some SPOR Evidence Alliance staff members who will be monitoring the chat and helping answer any questions. As well, at the very end of today's town hall, we will have a short question and answer period where you will have a chance to ask Dr. Tricco any questions you would like to have directly. So again, warm welcome to everyone, and I'll pass it off to Dr. Tricco.
Great, thank you so much, Clara. So it's real pleasure for everyone to see everyone here today. So lots of familiar faces and lots of friends and colleagues. So want to wish everyone a very warm welcome and thank you so much for joining us. I'm incredibly excited to talk a little bit about the SPOR Evidence Alliance updates and so what we've been up to, as well as future directions. And at the end, we should have a bit of time for a few questions. Before we begin, I'd like to start with the land acknowledgement and just would like to note that our central coordinating office is located on land now known as Toronto or Toronto. And for me personally, I would like to honor the elders and knowledge keepers, both past and present. And I'm committed to continue learning and respecting the history and culture of the communities that have come before and presently reside here. So I'm committed to learning, listening, and acknowledging the harms of the past and present. And if we know that many people might be joining from many different places, so please feel free to acknowledge the land that you're currently working on in the chat box, and we would love to see those acknowledgements. So a little bit about the SPOR Evidence Alliance. This is probably a refresher or reminder for many people. So this is a Canada-wide partnership between researchers, patients, and the public, healthcare providers, so that would be medical doctors and allied health professionals, and health system decision makers. So this was jointly funded by the Canadian Institutes of Health Research, or CIHR, and we had the opportunity to work with 41 different funding partners from public and not-for-profit sectors to create our research environment. So our mission is to promote a Canadian health system that is increasingly informed and continuously improved using scientific evidence. And all of our work is guided by evidence-informed methods. We're trying to ensure the highest standards in everything that we do. And our environment promotes inclusiveness, respect, and collaboration. These are core principles that we all live by and are incredibly important to us. So we make sure that these core principles and values are embedded in every single activity. And we also conduct our research with decision makers, and we include our patient and public partners as decision makers. And these individuals would use and be impacted by the findings of our research. So in terms of our key activities, our main activity is the research query service. So we have research teams across the country with diverse expertise to respond to the needs of decision makers. We also have a focus on training and skills development or capacity building. So we offer a range of courses and workshops, and this is to support and grow researchers as well as decision makers, as well as the trainees. So we do have a focus on that. And we promote and advance the use of scientific knowledge through ideas and innovation. So according to our mandate from CIHR, we focus on knowledge synthesis. So that would be things like scoping reviews, rapid reviews, systematic reviews, and whatnot, clinical practice guidelines, as well as knowledge translation and knowledge mobilization activities. So here's the SPOR Evidence Alliance leadership. So we have individuals located across the country, as you can see. We also have included patient and public partners as part of our leadership. We try to include a range of diversity in terms of skill set, in terms of level of experience, career stage, and different types of disciplines that are also included here as well. So we tried to be quite strategic. We also tried to ensure that we had linkages with other SPOR entities across the country as well. So our governance structure consists of 6 advisory committees. So we have 62 plus members, and we did a refresh in 2020. So we have a formal application and selection process. And to note that on our governance structure, we have patient and public partners that are embedded in everything that we do, including governance. And we also have 4 co-chairs that are patient and public partners. So we have an international advisory committee consisting of 12 members. We have our steering committee, including 8 members, an executive committee with 10 members. And then we also have our training committee, knowledge translation committee, and partnerships committee consisting of 10 to 13 members. And a question that we get asked often is, it does take a lot to upkeep our governance structure. So why do we do this? And what are some of the activities that the governance structure helps us with? So for example, they help us with many, many different things. So for example, communication, so our website content, our vision and mission statements. So we always do a little refresh on that. We published a series of papers in the Facets Journal, and that will be talked about in a few slides. So we had many different individuals on the governance structure involved with that. We've also produced an infographic on knowledge dissemination mobilization, which should be on our website shortly. So definitely check that out. And one of the committees helped quite a bit with that, actually producing that. Our governance structure also helps us with our policies. So our patient partner appreciation policy, this was co-produced with patient and public partners and is actually being used by different initiatives and organizations internationally because it's one of the few ones that was co-produced with patient and public partners. So that would be another activity of our governance structure. We also recently created a conflicts of interest policy, and I'll get into that in a few slides as well, but just to say that this would be part of our governance structure that would have helped us co-produce that. In terms of our processes, we get quite a bit of feedback and input from our governance structure on many of our different things that we do. So for example, the research query intake and management process. So we have individuals, and thank you to all of you on the executive committee who have reviewed numerous budgets and work plans. So the work plan is kind of like a mini protocol. So we have folks peer reviewing those and making sure that we have the highest methodological standards with those. Also getting involved with the patient topic intake and prioritization process, Indigenous people's engagement, so involvement with that. We do hold an annual seed grant competition, so helping us think through the process for that, as well as our clients experience survey for our query service, as well as membership registration process. So we see here the value in maintaining our governance structure and really is invaluable advice and support that we receive from all the individuals that are involved. In terms of our membership, so we currently are at 415 members across Canada and a few internationally. We openly welcome everyone, so you're welcome to join. We love to have more individuals come and join us. And we see the breakdown here. The majority are researchers, trainees. We also have knowledge users and patient and public partners. And we do have the geographic distribution here as well. So we do try to make sure that we have membership across the country, being as though this is a pan-Canadian initiative. So we have 35 specialized research teams, and we have broad partnerships across Canada. So you see some smiley faces here on our nice map, and just showing that our model makes sure that we have representation across Canada. And also here showing that we share the funding. So the research teams who take on the queries and do the research projects, we share the money with them. So that's what it would be really integral to our model and would be potentially a bit unique compared to some of other research initiatives. So not only do we share the work, but we share the funding and we also share the recognition. So again, a huge thank you to everyone here and all the individuals who've been involved with us and have been working with us over the years. So here's a nice snapshot of our journey. So we were funded in 2017 through a 5-year operating grant. And this then moved on to in 2018, where we actually went live. And this is when our query service intake process was launched. So there was a bit of a time gap between when we were funded in September 2017 to the spring of 2018. It did take us a while to develop all of those processes and develop our governance structure and whatnot. So it took us that amount of time and for us to be very thoughtful in all of our activities. So we also completed an asset map of Canadian guideline developers. So we had more than 1,000 guidelines in there, and that is on our website. So if you haven't had a chance to look at that, please do check that out. And again, as I mentioned, we established our governance structure. In 2019, our annual seed grant was launched. So this is to acknowledge the work of early career researchers as well as trainees. So it is something that we're incredibly proud of. And part of our seed grant, we have separate criteria. So we have patient and public partners who peer review as well as researchers, and we have separate criteria for the patient and public partners and researchers. And so we get asked from funding organizations a lot about what our criteria is and if they could have access to it, because it is a bit innovative in the way that we do that. So that's something we're quite proud of. We also created our patient and public appreciation policy. And we also have a mechanism where patient and public partners can submit topics. So this was launched in 2019, and I'll be talking a bit more about that in a few slides as well. And in 2019, we started accepting new members. So in 2020, we were hit with the pandemic. So we pivoted quickly to try and provide a response to COVID-19. So we did establish a rapid response model. And in this model, we completed many projects within 5 business days. So doing rapid reviews with very quick turnaround. So prior to the pandemic, our model was to do a rapid review within 3 months. But when COVID hit, we had to do it in 5 days. So our model changed quite quickly, no pun intended, and became very rapid. And we had to switch gears and make sure that we were supporting decision maker needs during that time. We also had several cross collaboration with many different initiatives, not only nationally, but internationally. And we provided a lot of training resources. So we invested quite a bit in trying to get the research teams up to speed and make sure everyone was on the same page to make sure that we could really provide a quality service to our decision makers. In 2021, our patient-driven research was a real focus. So we developed our course on rapid reviews. This was co-led by 2 patient partners who are amazing. So Maureen Smith and Janet Gunderson. And we also accepted 3 patient-driven research projects, which were funded. So these were projects, topics that were submitted by patient and public partners that underwent a prioritization process. So we had 11 topics submitted, and of those 3 were selected. I'll talk a little bit more about those projects in a bit. And in 2022, we had our collection of 4 papers on the SPOR Evidence Alliance published in the Facets Journal. And we were incredibly thrilled that CIHR provided us with a bit more funding for an extension of 18 months. And then this takes us to 2023, where we are today. So just to bring us back to what CIHR wanted us to do from the very beginning and how we've been able to manage to show our contributions and impact according to what they felt the need was within Canada. So the SPOR Evidence Alliance was established out of a gap that they had identified in the coordination of knowledge synthesis guidelines and knowledge translation nationally. So the first objective was that we would support the national coordination and project management of systematic reviews that benefit the health system as a whole across a range of diseases and health conditions. So we were not limited to a specific health condition or disease. And that was, of course, as per CIHR mandate. So we have provided support to 34 teams, and we have the capacity to conduct 41 different types of knowledge synthesis. So we've brought in above and beyond systematic reviews. And this has been done across 179 knowledge synthesis projects 41 guideline projects. We've completed the guideline asset map, and we've also provided 229 knowledge translation projects. So these projects were coordinated for 53 different decision-making organizations, and these were at all levels of the health system, so local, provincial, territorial, national, and international. And this occurred between April 2018 and February 2023. And our queries, as you see, I'm going to give you a flavor of them in a few slides. They cover basically anything under the sun, all kinds of different topics, health conditions, diseases, including the determinants of health. Another objective was to engage patients, clinicians, and policymakers and priority setting for projects. So we do have a centralized infrastructure. We prioritize research queries, and the goal is really on every single project to have a patient or public partner, actually 2 patient public partners. Sometimes we have more than that, a clinician or content expert, a policymaker, and a trainee, as well as research staff. So again, we've brought in above and beyond and try to take the CIHR objective kind of to the next level. So we have publications actually where we have authorship, co-authorship from all of the diversity in membership. So we're very proud of that as well. And these individuals are engaged in all of our activities, so in our governance, across our projects, and also as peer reviewers in our SEEK grant competition, as an example. And so in total, we have received 98 queries submitted by patients and the public, and this has been prioritized by all partners. So 3 queries are underway, and we are planning to fund another 20 queries, which will be prioritized in the next month or so. So I'll be talking a little bit more about that in a few slides. Ensuring sufficient capacity and developing a mechanism to respond to requests from provincial territory ministries of health in a timely fashion. So we've responded to requests of 53 decision-making organizations, as I mentioned, and we received 181 rapid requests, which we completed within an average of 51 days. So the range went from 5 to 195 days. And we do use a very close co-production or integrated knowledge translation model. So you're going to expect to see some variance here in the days, because it really is being tailored to what the needs are to our decision-making organization. So sometimes it'll take shorter, sometimes it will take longer. Sometimes it takes some time for us to get the feedback from all the diversity and partnerships that we include on the projects. And so, we try to tailor our timelines and make sure that everything is on track for all that we do. So CIHR had asked us to ensure a national scope, and we also had to include the ability to provide services in English and French and have international connections. So our query service is provided both in English and French, and merci to Annie Leblanc and her team, who helped us so much with the French queries, and we keep them very busy. So thank you so much for all of your tremendous efforts with that. And we have multiple international collaborations. So we've done several projects for the World Health Organization. We also have members from Cochrane that are on our governance structure, as an example, as well as the JBI, collaborations with Campbell and Gin, Evidence Synthesis Ireland as well, and Kaiser Permanente, as well as national. So for example, Knowledge Translation Canada and the JBI Canada connections as well. So CIHR had asked us to produce patient-friendly products. And so all of the research topics accepted by patients, so we do have that mechanism. And we also have our lay summaries. So we try to, for all of our projects, write a lay summary so that we can take the research results and quickly mobilize them to patient and public partners. We were asked to create a mechanism to interact and support other SPOR-funded entities. So we have numerous collaborations across SPOR. So we've worked with many of them, and we continue to work with them to this day. So in terms of supporting health system decisions, so we received 244 requests from 57. So these are the most recent metrics here. So it actually has gone up a little bit. So 57 different organizations, and we have 22 repeat service users. So sometimes people ask us, why is that low? And just to say that we have a model whereby if these organizations are not able to provide funding for the SPOR Evidence Alliance team services, then we do allow them access to our CIHR funding with the caveat that it's only 1 or 2 projects per year. So we've really tried to limit those repeat service users, and really the ones that do use it multiple times will have to pay for the services. So you see here the range of the number of queries and the range of different organizations that we've worked with. And in terms of the types of decisions that we've been helping with, so we've helped individuals that have been classified as health system managers or healthcare providers, other knowledge users or patients, and policymakers. So we don't accept projects from researchers. It really has to be a health system decision at any level of the health system for us to be able to accept those research questions. In terms of the range of decisions that have been informed, so the majority have been on public health measures. We've also helped with healthcare system arrangements, clinical management or guidelines, public health system arrangements, economic and social responses, knowledge exchange and mobilization, as well as more legal, administrative type of organizational policy. So you really see the range of decisions that we've helped with. And from this, we have been able to produce 254 technical reports, 253 other products, and 72 peer-reviewed publications. So one thing that we try to do is we try to make sure that we submit our report within that timeline that our decision-making organization requires, but then we try to follow it through because this is a CIHR-funded initiative. We try to publish our work, and the publications actually lead to quite a bit of impact, as you will see in the next few slides. So I'd like to highlight the service that we've been doing for guidelines and highlight a few impact stories. So we have received requests from 21 different organizations, and we've completed 41 unique projects by 14 teams across the country. And we've been able to engage 46 trainees and 88 patient partners in this work. So one project here that I would love to highlight would be led by co-PI Dr. Janet Curran, who's at Dalhousie University. So this was commissioned by the World Health Organization, and it was the foundation of their international guidelines. So here's their guideline, which actually cites Dr. Curran's work. And this actually impacts more than 150 million births per year. So incredibly pleased that the World Health Organization trusted us with this project, and Dr. Curran and team did an incredible job. They published their protocol, and I believe they're working on their publication as well. And this was used as a foundation for a really important and seminal guideline internationally. One project that my team had the privilege of working on was on gaming disorders. So this was commissioned by the World Health Organization to help them create their International Classification of Disease, or ICD codes. And so this impacts approximately 60 million people globally. And we ended up publishing this and providing the report to the WHO, which again, they cited our work. And then we also were cited in the Government of Finland guidelines. So I know sometimes we think that we can post a report on a website and that's enough knowledge mobilization. When we take it the step further, and I know it takes time and energy to do that, but when we do that, we can actually get cited in really important governmental documents internationally. So really important to think about this as you think about the research projects that you're working on. Another project that we were able to do for the WHO, so this was a project where we looked at infection prevention and control in long-term care homes. This was actually the foundation for the first guideline at the onset of the pandemic. So we did this in March 2020. So right at the beginning, we were contacted by the WHO, and this impacts approximately 5.9 million people residing in long-term care homes. We were commissioned by the Canadian Frailty Network to do an update on this, and this publication has been cited in the Organization for Economic Cooperation and Development Policy, in the Irish Department of Health report, as well as the Australian Department of Health guidance. So we do see that when we take it the step further, that many organizations will benefit from the hard work that the teams are doing here in Canada. So in terms of healthcare decision-making, so we focused a little bit about guidelines, but a little bit broader here. So we've had 39 organizations requesting our co-produced knowledge synthesis services. So this resulted in 179 unique projects. We had 28 teams across Canada helping with this, and we engaged 76 trainees and 189 patient partners. This was led by Dr. Little, who is at the University of Ottawa, and this was looking at the risk assessment for COVID. This was commissioned by the Irish Department of Health for their COVID strategy, and it was also used by the Economic and Social Research Institute of Ireland, impacting approximately 5 million people in Ireland. So, and here is a picture of the report, and again, huge impact internationally, not just here in Canada. Here's another one that we've been working on. So this is led by Dr. Deepa Singhal, who's at the University of Manitoba, and this is commissioned by the Autism Alliance of Canada. So this will be informing the first ever national Canadian autism strategy for the Public Health Agency of Canada, and there are multiple partners on this. And do want to give a huge shout out to Dr. Singhal and also mention that this work will be featured next month in the United Nations. So she will be presenting this to the United Nations, and the SPOR Evidence Alliance is incredibly thrilled and pleased to be supporting this very important work. Family violence intervention. So this was led by previous co-PI Dr. Purtis Moffat out of Aurora College. So this was commissioned by the government of the Northwest Territories, and this was impacting approximately 15,000 households looking to prevent family violence. They also did some sharing circles and did quite a bit of community outreach with this work. So very pleased and that the SPOR Evidence Alliance was able to support this work. Indigenous colorectal screening program. So this is being led by co-investigator Dr. Jennifer Walker, who's at McMaster University. And this was commissioned by the Sioux Lookout First Nations Health Authority for all of their First Nation communities. So Dr. Walker has been doing an incredible job, as well as Dr. Jull, as well as Dr. Mashford Pringle. They've been all working together and doing just some really incredible projects with Indigenous communities. And the SPOR Evidence Alliance is just so proud that we're able to support them in that way and provide them with funding and support to do the incredible work that they've been working on. So we also had a project that was commissioned by Unity Health Toronto looking at workplace violence in emergency departments. And this was led by co-investigator Dr. Cleon Hamilton, who's with Arthritis Research Canada. And we had a very nice quote here from Dr. Smith saying, "I'm proud that our work is now in print and available to emergency departments working to create safer spaces for staff and for patients." So really fantastic, again, that we were able to help with that. And we did have some patient partners involved with that work as well, which is just fantastic. So as I mentioned previously, not only do we have the focus on trying to provide decision-making organizations with evidence for their decision-making needs, we also have a focus on ideas and innovation, advancing the science. So at the beginning of COVID, we were asked to think about how our rapid review products, we've done quite a few of them through the SPOR Evidence Alliance, and how these may have been more challenging from a methodological standpoint. So we published our article in the Journal of Clinical Epidemiology, and this was actually cited by the Robert Koch Institute of Germany and also used by the Australian Living Guidelines on COVID. So again, very wide-ranging impact that we have above and beyond here in Canada. And also to say that based on this publication, the Brazilian Ministry of Health, as well as the National Health Services of the United Kingdom, invited talks from the SPOR Evidence Alliance to help inform their rapid response services. So they found our publication in the Journal of Clinical Epidemiology, and they invited us to give some talks and give some advice to them as they develop their rapid response services. So since the launch, we have provided more than 100 coaching calls. So we're always trying to help our teams. We've peer reviewed more than 200 protocols for all of our projects. We've completed more than 451 knowledge translation products. And we also have many different products, so including publications, infographics, plain language summaries, and again, used by 53+ decision-making organizations. In terms of our patient and public engagement, so we had 2 patient-led courses. So again, huge shout out to Maureen Smith and Janet Gunderson, amazing job. So they led us on these courses. And of course, researchers were invited, but it really was for patients, led by patients. We've also published 2 patient engagement evaluation papers. So not only do we believe as a core principle that we engage with patient and public partners, but we also have to evaluate what we're doing and making sure that we can take it to the next level and really make sure that it is very valuable and that what we are doing is that has been helpful to our patient and public partners and that it's effective. We also have 12 patient and public partners serving in our priority setting panel currently. So again, everything we do is from the perspective of patient and public. And we're just so thrilled that we've been able to work with so many different individuals, and a huge thank you and shout out to all of them for all that they do for us. So in terms of some of the engagement opportunities, so we have 98 topics that were submitted. So 3 were previously fully funded and 20 more will be funded by July. We have 17 patient and public committee members in the government structure, serving with 4 as co-chairs. We also have 24 patient and public partners who have been peer reviewers for our annual seed grants, which has been fantastic. And 284 patient and public partner engagements across 74 queries. And we've had 600 plus patient and public partner learners engaged in our capacity building activities. So in terms of our patient and public partner course, so this was something that we've done now 2 times. And so we did it in 2021 and again in 2022. And so the period previously included 23 participants last year, and then this year we've had another 23. So we have a total of 46 participants. So these are patient and public partners who are fully trained in knowledge synthesis. So the first year was focused mostly on rapid reviews, and then the second year we broadened that and we talked about scoping reviews and systematic reviews and even network meta-analysis. So we have 2 cohorts of patients that are trained up and ready to engage on the projects. So very pleased that we have these 2 cohorts, and it's been really incredible working with the patient and public partners. So just to provide a bit of feedback, so individuals were engaged across 10 provinces, and the majority were female and residing in Ontario, which I guess is no surprise given the leadership of the SPOR Evidence Alliance. And so 96% and 84% reported a greater understanding of knowledge synthesis, rapid reviews, and public engagement after taking the course. And 90% felt that the course helped them achieve their learning goals and that their learning experience had been valuable. So very excellent feedback that we received. And we received a quote here. So a participant said, "I'm learning a lot in this course. It's helping build my confidence. I participated in 1 rapid review before the course and tended to downplay my contributions. And this course has helped me understand my role as a patient partner and see the value of my contributions." So we were so delighted that we were able to help in that way, and just very pleased that we had such great evaluations. And again, a huge shout out to Maureen Smith and Janet Gunderson for leading that and for doing just such a fantastic job. And I will make a plug to say we are publishing a paper on this. So to be seen very soon. We hope to submit that in the next couple months. So I mentioned previously that we have funded 3 patient co-led projects. So this is a different model in that the topics are submitted by patient and public partners, and then we prioritize those topics. And if your topic is selected, then the patient and public partner is invited to co-lead the project. It is quite innovative. There's not a lot of opportunities for this type of empowerment internationally. So it is a product that we're quite proud of at the SPOR Evidence Alliance. So I do want to highlight these fantastic individuals who really helped with the pilot. We kind of didn't know what we were doing, or I'll speak for myself. I didn't know what I was doing, but really learning along the way, and just incredible the learnings that came out of this. And it's just really great to see the teamwork that's been done, and that it really is a different way of operating. So we do hope that we are making culture shifts, in Canada here, as well as internationally, in the ways that we're doing things and the way that we're empowering our patient and public partners. So one of the projects is looking at patient and public partners writing of lay summaries. So this is being co-led by Joanne Moselle as well as Heather Cahoon. And then another one is looking at alternatives to institutional care for older people, being co-led by Elliot Poss Jensen and Elaine Moody. And then trauma-informed care policies, practices to support caregivers, being co-led by Beverly Pomeroy and Lindsay Jibb. So just very fantastic work. It takes something to sign up for this and say, I'm going to do something completely new. So we're just very pleased and thankful and grateful that these individuals took a chance on us and decided to move forward with these projects. Currently, we went through a priority collecting or topic collection process last summer. So we received 87 submissions with 63 unique topics. And this was again in English and French. And so it takes a lot of energy and time to actually do this because we do lit searches, we do feasibility assessments, and we do screening and all kinds of background work to make sure that we really are avoiding duplication of research and reducing research waste, and that these are unique ideas. We're now working with the 15-member panel. So this kicked off this week, actually, and we're going to select the top 20. So of the 63 unique projects, we're going to select 20, and we're using a modified James and Lind Alliance partnership approach. So again, we will be planning to publish on that too, because it is quite innovative, because it's not usually the James Lind Alliance approach is on one topic, but this is on many, many different topics. So something that we believe other organizations might be interested in. And this, again, these 20 topics will be co-led by patient and public partners. So just to very high level training and capacity development, that we've had, more than 3,500 learner engagements. And I won't read out all these metrics to you, but just to say that, this is a huge priority for us, and that we do try to provide training and capacity and have as broad of a reach to many diverse individuals and organizations as possible. And we're very proud of our seed grant. So we've been able to fund 8 trainees. So some of them are at the PhD level, or some of them are at the postdoctoral level. And it's just been fantastic. And you can see here the range of the topics that these individuals have been working on. So again, we're just very pleased to support the next generation of scientists. And for our seed grant, as I mentioned, we do have our patient and public partners who are peer reviewers alongside researchers. So a huge thank you to everyone for helping select these amazing projects. In terms of knowledge production and mobilization, so we are always trying to provide resources to the teams and make sure that we can do our work better. So we do provide 2 tools, which I will talk about actually the next slide. We also have 8 widely used resources that I've mentioned before, and 2 co-created policies, so our patient appreciation policy as well as our conflicts of interest policy. We have our series of papers in the Facets Journal. We're regularly doing our newsletters, and we're on Twitter quite a bit, of course, social media. And we've been able to deliver quite a few reports, publications, presentations, and other products. So we developed the right review tool. So this is for you to help decide what review is right for you. So we have 41 different knowledge synthesis methods. We did publish on this in the Journal of Clinical Epidemiology. So definitely check it out. And we'll put a plug to say that Dr. Barbara Klein from Ireland is working on the extension of this tool. So she will be making some updates to the tool. So updates to be determined. And then also Dr. Zachary Munn from University of Adelaide also received some funding to build on this tool. So really great that we were able, through the SPOR Evidence Alliance, to come up with this prototype that is now being used by organizations internationally. We also received a Canadian Foundation for Innovation grant. This tool, it's the Synthesi.SR-CAL AI-enabled tool. This has already been used by 4 SPOR Evidence Alliance teams in our pilot, and we're planning to scale this up for all teams in the next 1 to 2 years. So as we get more and more requests from decision-making organizations, we have to make sure that we can respond to these requests. And so we definitely need to think of the future, and we need to be innovative, and we need to think of ways that we can use AI to enhance our work and make it more efficient. So this is something that we're actively working on. Again, I've mentioned a few times our series of papers on the SPOR Evidence Alliance. If you haven't had a chance to read them, then please do. We also have many different resources, as I mentioned, so please look at them. We have a series of templates. We also have embedded equity, diversity, and inclusion in all of our templates. So at each part of the whole entire process, we ask you to consider equity, diversity, and inclusion. So please check the resources out, and I'm sure they will be helpful to you in the work that you're doing. So our conflicts of interest policy was recently released, and so this provided a clarification of reporting requirements. We have quite a few reflective exercises, and we also have some new clauses. So this was effective as of April 28th, so something very recent, and this has been promoted. And we did receive some really great quotes, so I won't read all of them, but I will pick Allison Hoynes. So she said, kudos to the leadership of the SPOR Evidence Alliance for recently approved conflicts of interest disclosure policy. It provides the foundation for transparent processes to identify and address real, potential, and perceived conflicts of interest for its members. So thank you so much, Allison, and great to hear that it was helpful. And again, we hope that this policy is going to be used by organizations internationally, because we cover the range of the different partners in there, and we do have some quite thoughtful, reflective questions for everyone to think about. So I did mention our clinical practice guideline asset map. So it consists of more than 1,000 guidelines and 100 guideline developers. Please look at it. It is an interactive map on our website, and it has been used in research. So it has been in a paper that was published in the CMAJ as an example. We also are working on an external evaluation. So this is an arm's length evaluation of the SPOR Evidence Alliance. So this is currently underway, and it's expected to be completed by October 2023. So we are very excited to see what the results are, and again, to see how can we improve everything we do. We always come from a growth mindset, in that we always try to make sure that we're growing and we're learning, and that we're always trying to make it a great experience for everyone involved in all of our activities. So in terms of future directions, we are thinking of coming up with a sustainability workshop. So we're hoping to do that later on. We are trying to work with other funders and seeing if there is a way that we can extend. So we do have our funding period ending December 2023, which will come sooner than later. That being said, we are able to spend the funding up to 2025. And just very, very quickly, because I'd like to allow at least a few minutes for some question and answers, because I'm seeing quite a lot of activity in the chat and Q&As here. So I do want to leave some time for that. I just want to show how we are aligned to the CIHR strategic plan. So in terms of advancing research excellence in all its diversity, so we have we will have supported 23 patient-led projects, and we also supported an anti-racism project for the Ontario SPOR Support Unit. So that was led by Dr. Linda Lee. So kudos and shout out to you for handling such a complex and very important project. We've supported 34 collaborative teams across Canada with 400 plus diverse members. We've enhanced national and international collaborations, and we've also promoted open science through all of our work. In terms of strengthening the Canadian health research capacity, so we've provided learning opportunities to more than 3,500 plus learners. We support the inclusion of trainees in everything that we do. We funded 8 trainees, early career researchers through our seed grant. And then, we've trained our patient and public partners through our courses. In terms of accelerating the self-determination of Indigenous peoples in health research, so we've supported 5 Indigenous-led projects arising from the community. We've also had the privilege of supporting 3 Indigenous-led events, and these were attended by numerous hundreds of people, and there was also a podcast that we supported. So again, the SPOR Evidence Alliance is committed to learning from our Indigenous partners and helping and supporting in any way that we can. And regarding health equity through research, we have embedded justice, equity, diversity, and inclusion in everything we do. These are core values, not only for us as human beings, but also for this research initiative. We also have completed projects on reducing health inequities. So for example, I'm not sure if Dr. Vivian Welch is on the line, but her team is, her amazing team is working on reducing poverty in children in the Northwest Territories. So huge shout out to you and your team. I know that's a messy project and you're doing an amazing job. So thank you for your help with that. And then we've also helped, quite a few projects globally with the WHO. In terms of integrating evidence in our health decisions, so we've completed more than 450 knowledge mobilization projects. Everything that we've done has been for a policy or practice decision maker for their decision making. We've advanced the science through many of our activities, and then we also try to provide innovation in all of our work. So two examples would be the tools that we've provided to the research teams to make their work easier. So we're always there to support our research teams, and we're always trying to find ways that we can be more innovative and more efficient in what we do. So I do want to give a huge shout out to our central coordinating office, who are just amazing. I am just so grateful and humbled and privileged to be able to work alongside these individuals who are all brilliant superstars, and that they always find a way to make me look good and help in so many different ways. And I learn from them every day. And so huge kudos and shout out to all of you, and really appreciate all of your help and support and everything that you do for me and for the SPOR Evidence Alliance. So want to thank you all for attending today. Such a pleasure seeing so many smiley, friendly people on the line today, so many friends and colleagues. So thank you so much for joining. I hope we can get through some of the questions. If not, I love hearing from you. Email me anytime, or you can reach out to me on Twitter. Again, really love hearing from the audience and hearing what your story is and how you've been potentially impacted, or if you want to learn more about the SPOR Evidence Alliance. I would not do my job as a researcher if I didn't acknowledge the very generous support from CIHR. So a huge thank you to CIHR, as well as the 41 organizations that believed in us and have provided us with funding over the years. If you want to check out our website, we have a lot of the resources that I talked about today on there. We're active on Twitter. And again, we love hearing from you. So please feel free to email us at any time. And I think with that, we can go to the question and answer period. So I will now, I think I'm handing this back to Clara. So I'm going to now stop sharing my screen.
Yeah, thanks, Andrea. Thanks for a great presentation. So we got a couple people in the chat asking about links and things like that. So as Andrea mentioned, a lot of our resources and policies that we talked about in this presentation can be found online. So Sally has been super on top of it. And in the chat, you can find details and links to our different research projects by patients, seed grant projects, as well as resources for research teams. We had one question in regards to, I don't know, this is an interesting question, I think. It said ChatGPT is very good at writing lay summaries of scientific research, possibly already better than the average human. How will this impact your mandate?
Yeah, that's great. No, thank you so much for mentioning ChatGPT. So at this point in time, we're not planning to use ChatGPT. I think part of it is that we use such a tailored approach in terms of having the patient and public partner who is involved with the project from the very beginning help us write those lay summaries. So we aren't planning to use ChatGPT right now. It might be an interesting study to see how our lay summaries differ, because these would be patient and public partners involved with the project, because we use a very intensive co-production model. So it'd be interesting to see, how when we have this co-production model and they write a lay summary, how that compares to ChatGPT. So maybe, I'm not sure who asked that question, but maybe we can write a grant on that and get some funding to do that study. But at this point in time, we're not planning to replace, our amazing patient and public partner lay summaries with ChatGPT.
Thanks, Andrea. It's definitely a very new topic, I think, that a lot of research will have to consider. And also, if individuals want to ask questions live, feel free to just raise your hand and we can unmute you. Otherwise, feel free to continue putting questions into the chat or the question answer section. We have a question from Simon Bacon. So
Yes. Hi, Simon.
Hey, Andrea, can you hear me okay?
Yes. Yes. Thank you
Perfect.
for coming.
No problem. Well, first of all, congratulations. An amazing effort by the whole team. Just wonderful evolution.
Thank you.
I guess I had sort of one broad question, which was just more of a technical thing about, have you actually got a map of how things have evolved year on year and sort of a capacity to show expansion,
Yeah.
which I think is always nice.
Yeah, that's such a great idea. Thank you, Simon. And we've heard from many people to actually do that. So I like that. Even to say, like, we started off with maybe 10 teams and then now we're at like 35, 34 plus teams. So even like with the teams, with the membership, it might be a kind of cool visual that we can include on the website. So thank you for mentioning that. And I think that's something that the team will have to look into.
Perfect. And then just sort of the corollary to that is, and I know there was the extension from CIHR, but do we have any understanding of the longer term funding piece for this amazingly important work?
Yes, thank you. So we don't. So that's something that we have to think about. So in terms of sustainability, so making sure that CIHR is aware of our impact, and they are waiting for our evaluation, which will be coming out in the next couple months. So hopefully with that evaluation and whatnot, we would be able to make sure that we have longer term sustainability, because the 18-month extension came up very quickly. It came by so much faster than we expected. So it is something though that we are really cognizant of course, because we want to make sure that we can keep going and keep doing the really great work. And really the work is by teams such as yours, Simon. So huge shout out and kudos to you for all that you do and all that your amazing team does. So we want to make sure that we can continue supporting the amazing work of your team and all the teams. And of course, supporting decision makers across Canada and beyond. So something that we're actively thinking of. And if you do have any suggestions, Simon, or if anyone does, please feel free to reach out and let me know, and would love to hear what everyone's suggestions are on that.
Thank you.
Thank you.
All right. I don't know if there's any more questions, but we'll leave the chat open. Yeah, so I think in the chat, if there's any other questions, feel free to follow Andrea, and as well as SPOR Evidence Alliance on Twitter as well. Or if you have questions, you can definitely email the Central Coordinating Office with Andrea if you have questions after the webinar. We'll just wait a little bit longer for maybe a couple more straggling questions.
I think we have a question from Ian Graham.
Oh, yeah. Oh, I think Ian just posted, oh yes, the not yet completed CIHR CAM strategy seems to have a large focus on synthesis, so perhaps there will be new funding opportunities.
Yeah, no, thank you so much, Ian. So I was part of, I'm sure you were, and many people were part of the discussions with CIHR on that, and was very pleased to see that evidence synthesis, knowledge synthesis was kind of placed front and center, and that many policy decision makers said that, we need to continue with knowledge synthesis in Canada. So I'm hopeful as well, Ian, that, there will be new opportunities for funding, and that, we will find a way to continue doing the great work that all the teams have been doing. So again, it hasn't been fully released, as you allude to in the chat box here. So we'll be following that space very closely and waiting to see, what the decisions will be. So thank you for mentioning that. I think I saw Eva. Did someone have their hand up? But maybe it's gone now. Oh, okay. I see Simon. Yeah, go ahead, Simon.
Cool. I'm always one for taking any time I can to ask questions.
It's great. It's great.
So what actually it's more of a comment than a question, because I was thinking about the AI engine piece. Yeah. And one of the things that, obviously, having gone through this living evidence synthesis piece, and then we've got some other parallel evidence, living evidence syntheses. To me, this probably creates the greatest opportunity to really test and ingrain some of that AI pieces, because of the history that you create with that, and then the potential for the repetition of this. And so I'm just throwing it out there, partly comment, partly fishing to see if there's an interest in maybe doing something with that and some of the living evidence syntheses we do have going on, and what your thoughts are.
Yeah, we would love to. Email me, Simon.
Yeah.
Right now, it's just been like, we've been just piloting it with different teams, but if your team would like to use it, email me and we'll make it happen for you. So absolutely. Yeah, and the teams who've used it have loved it and it has been incredibly helpful. We haven't used it in the living space yet, but I think it is something, like you said, it's a real opportunity. So something that we need to do. And yeah, we are planning to scale it up. Right now, the tool is a bit clunky. It does help, like it decreases, and we've published on the tool too. So I'm happy to share that with you, Simon, and others. So we have used it in some of our knowledge synthesis. It does save time. It is more efficient, but we just hired a student actually for the summer to make it a bit more streamlined. But that to be said, we can offer it to select teams. So if you would like to use it within the living space, then absolutely reach out and we'd be happy to provide it to you.
Fabulous. Thank you.
Thank you.
We have 5 more minutes, so again,
I think I see a question here. Was this already answered? The one? Oh yeah, so the more information on the alternatives. Okay, perfect. So I think all of these. Perfect.
Yeah, there's a few questions on the patient partner appreciation policy that we answered, and a lot of thank yous in the chat for a great presentation as well.
Great, well, thank you. And again, it's just been a pleasure to highlight and showcase the work of all the amazing teams, and you know, it really takes a village to do knowledge synthesis in Canada and knowledge translation and guidelines. So kudos to everyone for all their hard work, and thank you especially to the Central Coordinating Office for keeping us on track and for all that you do. So I think we can potentially end a few minutes early then today. Like we said, we love hearing from you. So if you do have any follow-up questions or thoughts, please feel free to email us, reach out anytime. You know, huge thank you again for all of your support and for all that you do. So thank you, thank you, thank you.
Awesome. So with that, I guess we'll give everyone back 4 minutes to their time. And thank you again, everyone, for attending. And you'll receive a recording of the SPOR Evidence Alliance town hall. It'll be posted on the website, as Andrea mentioned. And yeah, thanks, everyone.
Thank you. Take care, everyone. Bye.